So I am working on the assessment manual that everybody will be following at Enhancing Life. That way our service is consistent. On here, I talk about how the assessment is introduced because that is huge. And I wrote, the assessment should not be described as something that is used to tell the client's dysfunction or anything that has a negative meaning. I've been very guilty of that in the past. People, coaches, and physical therapists that get into things like PRI are very, very guilty of it. It's happened to me. I Until last year, I didn't have any pain, but before that, I saw a physical therapist, and she told me that I needed to go to Prime, which is go to Nebraska and pay like $6,000 to get all this shit done. And when I asked her if I could still strength train, she said no, because it will feed my pattern. Who the fuck says that? So that's like the worst thing you could do when it comes to an assessment. And when from a training perspective, I've known trainers, and I've done it too, because you learn it in a course and then you want to explain it to a client because you get super excited, but a client does an adduct and then they do extend on the extension drop test, and then you feel compelled to tell them that their femur is coming out of their hip socket and they've stretched the ligaments out of the front of their hip. Not good. The assessment shouldn't make people feel bad about themselves, especially if you're dealing with people who are in pain. What the assessment should be is you need to highlight that this assessment will help pick the right breathing strategy for them, or breathing exercise. People love individual work. And then it will help them move better, and it'll help them be more efficient lifters, and it'll help them move more with less pain. So more, and I got this from Kyle Dobbs, is look at the opportunities versus looking at the problems, and that's kind of the shift that you need to make. Then I go into talking about our 3 different clients, because the assessment might stay the same, but the way we describe it is different depending on the client's goals. So we got our main client, the persistent pain client. For these people, the assessment can be very, very meaningful, and it can help with buy-in. Because if you're dealing with someone in persistent pain, they most likely have seen other practitioners or are currently seeing other practitioners. So they've probably gone through the ranges of motion or the tests, that similar tests that you are doing. So when they get a positive change on the table, that is very meaningful for them because they've been trying to get positive changes with other practitioners. The other thing that this will do is if they connect that you did a test, then you did a breathing strategy or intervention, and then the test got better, they're more likely to perceive that exercise or that breathing exercise as something that's safe and something that's good for them because you just got a positive outcome. So for people in persistent pain, the test and retest system is awesome for them because it's a way you get them to buy into your protocol. You can even train them and test and have improvements, and that's happened before. So it's my way of showing them, hey, this is good for you. This caused positive movement changes, therefore it's probably not going to hurt you. So they're less likely to have a flare-up, or at least that's the hope. Then we move on to fat loss clients that we do not have much or many of them. So depending on the person and depending how much extra weight they carry, we might just not do the assessment because they're not going to be able to find the muscles we want them to find, and it's just going to leave them frustrated. And they have a constraint that you can't get over or can't get rid of overnight. So with these people, we might cue them to tuck and exhale, but we are not going to get super concerned if they feel the right things if we get table test to change. So we usually leave the assessment for these people depending on how much weight they carry, and we just don't do that, and we just get them moving, and the goal is fat loss. And then once that happens, then we can start introducing some breathing strategies and see how that goes. Then we move on to our lifting clients, people who want to lift heavy, but they want to do things right, and they like learning about themselves or about their own body. For them, the assessment is not that meaningful. They don't see the connection. So that's where you got to use your words. You got to use words like the extra hip motion that we just got you will help you gain extra motion, or will help you hit certain depth in your squat, or will help you deadlift without tweaking your back. So you got to connect it back to their goals. The other thing that you can do with these people, especially if they've lifted before, is you use lifting as the assessment. So what we get a lot of is people who've tried lifting and it doesn't feel good. So we'll use that as in the assessment. We'll have them squat. How's that feel? Well, it hurts my knee, or I can't get below parallel, or whatever, or I can't keep my heels down. Then you assess, then you do a breathing intervention, and then you reassess, but you take it back to the things that are meaningful for them. So that's how you can introduce an assessment to a client who wants to lift. You use your words, you make it meaningful for them. So same assessment, same breathing interventions, but with your words, if you point certain things out, you are more likely to get buy-in with the assessment.